Now, this is Lori. Dr. Morse, I would believe in it if you would review my sister's case. All right, this is a lady's sister. Let me see. My sister was a very happy, healthy, vibrant 61-year-old woman. Wow. She was never ill throughout most of her life. The only serious condition she did have was pneumonia, okay, about 4 to 5 times. 4 to 5 times, you know, that already tells you immediately her lungs and bronchi was full of mucus. No one let her clean out her lungs, so she always said she had pneumonia 4 or 5 times. One good pneumonia case, we can clean you all up and you're done. But because medical suppresses and treats it as if it is pneumococcus, including when she was a child. The last incident of pneumonia was about 2 years ago. In all cases, she was given, of course, antibiotics which seemed to clear up the problem. No. And I'm glad you used the word, because you're using some good words. It seemed to clear up the problem. Well, what it did was suppress the lymph system. Then she started getting a cough that would not go away. With stabbing pain when she was inhaling. Well, because she never cured her pneumonia, did she? She never cured what they called pneumonia, did she? No. And so what she did was go to a medical doctor that doesn't know anything about curing anything, but they know how to treat real well. And this is what happens. Her primary care physician suggested a CAT scan to find out what was going on, I bet, in her lungs. The scan revealed 2 large masses in one of her lungs and a smaller mass in the other. At that point, she was told that it looked like lung cancer and was admitted to oncology floor of the hospital. Yep, this isn't getting any better. The masses grew rapidly, doubling in size over a period of 3 days. She's got serious lymphatic problems. Why the ear pressure? Why all that, right? This is all lymph. What are masses? What symptom? The lymph system. So she's got heavy lymphatic problems. She hasn't been filtering her kidneys for years. And the pneumonia is a time to take advantage of that and clean out the lungs and stuff. But they don't know how to do it. They just suppress with antibiotics. So she's got a lot to clean out here. And there's no way they're going to let her clean out, because every time she starts to clean, they're going to give her more antibiotics to stop it. Because they see detoxification as a problem or something. They don't get it. And that does nothing but kill lots and lots and lots of people. Might be their agenda in an unconscious way. Who knows? Don't they work for the IMF, the World Bank? Maybe they haven't been told who they work for. Will she ever get rid of toxins in her body? Not the road she's walking. If you can get her, the only hope she has is to detox. Does it make sense? Why? Because how do you get masses out? You clean them out. They'll come out, just like you're forming them. But if she doesn't get on the road to do that, then there is getting no better. All they're doing is suppressing her adrenal function. All they're doing is trying to throw anti-inflammatories in there. Well, guess what? All fruits, all berries, all melons, all salads are anti-inflammatories. Most of the herbs are anti-inflammatories. You can't use you can use anti-inflammatories that are not suppressive, like steroids, to the adrenals. But taking prednisone, she'll lose her adrenals. And when she stops it, she'll explode. Because it holds all this mucus and stuff in the body. No, she's going down the road to, I'm going to kill myself allopathically road. No offense. But people got to wake up sooner than later here. Need to do this one video for those out there that don't understand the reality of detoxification. Simple symptoms are cold and flu-like symptoms, the running of the nose, the coughing up of mucus out of the bronchi and lungs. Well, thank you. You know, no one ever died from pneumonia except when you go to a hospital and you take antibiotics. No one should ever die from pneumonia. Your body's getting rid of a lot of congestion. Guess what forms masses and tumors in the lungs? Same stuff you're coughing out, my friends. Same stuff. And out of the sinuses. Most people can't breathe or smell properly. People snore. People have sleep apnea. People can't hear right, taste right. Well, of course, they're saturated with mucus. This is quite an interesting thing. She had a cough. She's diagnosed with pneumonia. Of course, antibiotics didn't improve it because pneumonia isn't from bacteria. No pneumococcus here. Could be, but could not be. It's just congestion. We should get that. So once you realize that symptoms occur when you create it, and same symptoms occur when you uncreate it, 2 times you always feel the symptoms. So when people go through healing crisis, don't be surprised. If someone's had pneumonia in their past, they're likely to go through it again. No one ever died by pneumonia doing it, detoxing and doing it the right way. People generally die from the treatment of these things. You have to realize that. People die from the treatment of these things. It's because the unconsciousness of allopathy and pharmaceuticals and of the FDA allowing these sort of practices to occur. Let me see here. Pneumonia, you've just got to let your lungs clean themselves out. If you freak out every time you have a pneumonia type of feeling, and I know it's panicky and scary because when the adrenals are down, so breathing is always an anxiety thing. No question, went through it myself. So I know all of that, but by using that brain to nerve number 2, you're strengthening the nervous system by increasing the adrenals, you're increasing neurotransmitters, which is increasing neurological function, and at the same time you're using herbal antispasmodics so you don't retard or stop expectoration. The worst thing you can do is stop the lungs from expectorating because that's your next cancer in mass. You can't lock acids interstitially. That is the most dangerous thing you can do to your cells. And then, of course, lung cancer is not fun. And then, of course, the more acidic you fill up with fluids because, again, the response to acidosis is edema. So just remember all of that.